Hi, Facebook. All right. I'm just going to wait a few minutes for everyone to be able to log on and for Facebook to cooperate. There we go. Hi, Judith. All right. So today we're going to be discussing healthcare professional students' mental health during this time. Um, a lot of healthcare professions are obviously really affected right now. And it's difficult for them to figure out how to cope with such an issue being in that field itself, but not really being in it yet. So I'm just trying to align these cameras somehow. All right. Okay. So if anyone here is a healthcare professional, go ahead and drop it in the chat or in the comment, and I can bring you live onto Instagram at least, and maybe we can have a chat. But basically, I'll just go over some things that are really significant right now for healthcare professionals. So I'll start with the medical student community. There's a lot of grief going on around losing certain milestones. It's kind of similar to other student groups. Medical students have lost match days, which is where, they get to walk across the stage and they get to get a little envelope that says where they're going for their residency. And they get to open it with their friends and family and really enjoy that moment that, I've worked so hard for this day to find out that I get to go to residency in the field that I have chosen. And so that's one big milestone. Graduation, of course, is another milestone that they're going to be missing out on right now. And a lot of medical students are actually going to the front lines directly from not being done with fourth year, which is it's a very odd time. I know Boston University School of Medicine had a specific graduation ceremony early on to make sure that their students could go ahead and get on the front lines immediately. Now, most students are very eager to do this, right? I mean, this is why they entered the field of medicine. They want to help people, they want to help the medical community. But some students, I was reading an article, some students are very uncomfortable with what's going on, which is totally understandable. And I think the importance of today's live is to really acknowledge the fact that it's okay that you're uncomfortable, even though you are a med student, even if you are a nursing student. It's okay to be scared right now because, I'm sure a lot of these students signed up for their specific residency area or what they kind of molded to be their life in medicine. And, no one foresaw this, no one foresaw that there would be a pandemic going on that these students would have to learn about. And unfortunately, many graduate healthcare professional schools that are not focused on public health, they don't teach public health specifically in depth. So there is also just a kind of question of how do we deal with this? How do we answer some of the questions the patients might have? They don't have all of the answers, being fresh students sometimes. And so that burden can be quite hard to handle. Let me know if you have any questions in the comments. I'm covering kind of healthcare professionals and how they must be dealing with what's going on right now, especially students. So I can move on sort of to public health students. So I myself am a graduate public health student, and in the public health professional schools, there have been posts going on, one after the other, talking about how to volunteer right now. So the subject that this whole pandemic falls under is epidemiology, which is the study of how diseases spread, how to contain the spread, how to locate the spread. So if you hear of anything called contact tracing, that's actually where the patient who has COVID-19, the doctor or someone does an interview of them where they ask them, where did you go last? Who all did you meet in the past 2 weeks? Where did you go? What did you touch? Basically, that's what they're looking for. This is called contact tracing, and contact tracing is an epidemiology kind of term to find out where COVID could be and where to warn people to kind of stay away for a while, or if they've been in contact with this person, asking them to quarantine for 2 weeks in order to not spread the disease. All of this is public health terminology and public health practices. So public health students are feeling a little bit burned out and a little bit concerned because there is a lack of knowledge around this specific area, and even in the way that the pandemic is being handled, not enough public health measures are being consulted, which is just frustrating with it being a public health crisis. And so we have kind of posts in our Facebook groups of our health professional schools where they are asking us to come volunteer as contact tracers because there's such a need right now. And, I have some wonderful colleagues on social media who are posting what they're finding as they go in Harris County. And so I think it's really important for us to acknowledge the burden and the fact that it must be really hard right now being someone in the public health professional field, going into that field, going into being an epidemiologist. They're on the front lines too right now. I have friends who have accelerated their second years of their masters who are on the field immediately right now. So it's similar to the med school problem where they're kind of being pushed out in the field without knowing what to expect. So it's important to acknowledge this kind of shock to their system and know that it's okay to be a little rattled right now. I'll go to a question really quick. Gustavo asks, how can health professional students who study prevention and interviews cope with folks who are not following orders or prevention strategies? Sometimes it's irritating to see folks not following what are basic strategies for us. So this is something I personally relate to, being a public health student who has studied prevention and interviewing and contact tracing. It is frustrating to see when individuals are not following the prevention protocols. So I think the miscommunication that has happened between kind of general society and public health professionals is that we are not telling people to social distance or to wear masks or to wash their hands to provide any sort of restriction on their lifestyle, right? This whole protocol is to save lives, and it's not necessarily one person's life, right? If I tell one friend, hey, can you please not go to this crowded party, it's not safe, I'm not necessarily speaking to that one person's health. This is a pandemic, this is a communicable disease, is what it's called, and it can spread from person to person, right? So if I am asking this one person not to go to a large party, a large gathering right now, it is in order to protect everyone in that gathering, and everyone who that gathering is going home to, and everyone who that gathering will meet at a grocery store. So it's all about this kind of train of contact or a path of contact that can happen if one person contracts COVID at a large gathering. It doesn't even have to be a large gathering, unfortunately. That is why the order went from 10 people to anyone who doesn't live with you, because even if you meet one person out here who has had contact with COVID and is not showing symptoms, they can potentially spread this disease. And Houston, unfortunately, the graph of cases I was examining yesterday, the cases are rising, and so it is important. And that is something that public health professionals and medical professionals are facing frustration with, is that they would really like for the community to cooperate with them, because unlike cancer, unlike these other diseases that are being argued to have more deaths, this can be spread from one person to another through various forms. And we don't know enough about the disease to make certain calls. And so it's important to kind of be as cautious as we can. So thank you for asking that question. It is something that is hard to cope with, and I think the best way to cope is to think that you are doing as much as you can by contributing, by being a contract tracer part-time or full-time, by being an epidemiologist, by being a health professional student, by doing your part, social distancing on your own, by telling your family at least to social distance. As long as you are doing everything you personally can that is in your control, that is the most important thing. Because you cannot control someone else's actions, right? All you can do is advise and ask for them to follow protocol to help lessen the burden on healthcare professionals and to um, lessen the spread and to kind of flatten the curve, as we're saying. So thanks for that question. Another type of, I can move on if there's not another question. Let me check really quick. If anyone has other questions, please drop them in. But another kind of health professional, how can I take care of my mental health when I'm taking care of others? Burnout is real. Yes, it is real. Thank you. Thank you for that question. So how can I take care of my mental health while taking care of others? So there is a term for this which is happening right now. It is very common already in healthcare professions. It's very common to occur on various ends of this pandemic, I would say. So what I mean is various ways that people are working in this pandemic. People are getting burned out in different ways. Medical professionals are getting burned out because they're having to wear this mask that's incredibly hard to breathe in all day, see various patients, not be sure, honestly, how to maybe treat some of them or not sure how to categorize some of them, which is an issue right now. COVID has so many symptoms that are kind of unknown or coming up suddenly. And so that frustration is there and can lead to burnout because you're frustrated. You don't know exactly what to expect. So in order to take care of your own mental health while taking care of others, I would say it is really important to take a step back. You need to take a step back. After work, you leave your work there. You walk into your home. For example, if you have children, your children want to hug you. They can't. You have to go take a shower first. You have to go change your clothes first. You can't touch anything in the house. You know, they have to keep all these things in mind. And then once they're done kind of washing literally the day off of them, it is so important to maybe not watch the news for a while. Maybe just spend time with your family, your friends, your kids. If you're living alone in your apartment, have a Zoom meeting with your friends. Like, have a Zoom happy hour. Have whatever you can do to de-stress and not think about your job. I think this is an important thing a lot of us kind of forget. I myself, it happens sometimes where when you're socializing or you're spending time after work, you end up talking about work. But it's so important to have a real division between your work time and your personal time, especially right now for healthcare professionals. Another way to take care of your own mental health is use those strategies that are so common in general, not specifically to this time. Take some time to journal in the morning in terms of what you expect your day to look like. Take some time in the evening to kind of rant out in that journal, your frustrations or your fears, or take that time. Make sure you have human connection in some sort of way. Limit your time with the news. Limit your time with all the COVID news going on 24 hours a day. If you're seeing it, especially in daily life, every single day, 9 to 5, whatever your hours are, make sure you kind of limit that content and do something that you love. Do something that will take your mind totally off of it. Take a bath, read a book, do yoga, do meditation, do these things that will clear your mind, literally. That it really helps in clearing your mind. So these mental health practices can help a lot. Hello! If you have any questions about healthcare professional mental health, let me know. Let me see, I have all right. I'm just reading through some comments. Thank you so much, Brenda. Really appreciate it. All right. So we're about halfway through. I'm trying to see if anyone would like to come live. There's someone named Fatima here. Hey, Fatima. Are you a healthcare professional student? Brenda, do you have any questions for us? Anything in particular? Just waiting for some response. But there are some other kind of resources I have open here to talk about. The WHO themselves have provided a page called Healthy at Home, which is where people can figure out how to maintain their mental health. One thing that I have seen pretty frequently is alcohol abuse going up, right? That's the thing for a lot of us. A lot of people are stuck at home and they're like, you know what? I'm just gonna drink whenever. And while this can be, something that is socially done in general. Right now it is more difficult because you have so much time to be in your mind. You have so much more time if you're at home, if you're remotely doing work related to COVID-19, which is the story of a lot of mental health professionals and public health professionals, and even people providing telehealth medically. It's so important to take that step back. Sorry, I got distracted by a comment. And not to cope with substances. Where, it's really easy right now. Your workplace has everything you need. You have the whole pantry, you have the whole kitchen. You can just go downstairs and start, even snacking on junk food all day. But it's so important to take care of yourself, take care of your health right now, given the pandemic and given your mental health. Eating healthily, limiting your alcohol intake, limiting your fat, your junk food intake. This is all very important right now for our immunities, for our mental health, for stress to go down, not to have some sugar highs and sugar lows, which are common to induce kind of negative thoughts. Screen time, this is another big one for us, especially if we're working all day, right? We're in front of a screen from 9 to 5. And then if we're kind of scrolling on social media, again, reading about COVID-19 possibly, or taking in information that is just going to stress us out more, it's important to know when to identify that emotion of stress, right? If you can identify that, oh, this, Instagram is really overwhelming me right now. How are these people who have 9 to 5 jobs coming up with so much Instagram content? That's one thing that's going through a lot of young people's minds. A lot of young people I know who are health professionals run an Instagram account for that purpose. So that's just an example of something that the medical healthcare professional students are going through today. And then, sorry, just trying to find some. Fatima, if you're still interested in going live, please let me know what kind of healthcare professional you are in the comments. So here's one thing that is very important. I will say mental health professional wise, if you're a student in this field and you're seeing that mental health is being heavily affected by COVID, by our times right now, our situation right now. If you're a mental health care student and you realize that, yeah, the burden is going up, people need teletherapy, people need financial assistance to get therapy right now. It's important to look into these resources and look into, for example, our website, Mental Health America of Greater Houston, mhahouston.org. MHA National also has several resources that we can look into to share with our friends. I know a few mental health professional students who are not sure how to help right now because they cannot provide therapy, but they can share resources. They can be a listening ear to their friends. They can be a shoulder to cry on, maybe. So, if anyone can help with Brenda over here from MHA on Facebook, that'd be great. So, I personally don't have an answer to your question, but we can look into it after the live. Thank you so much. So, does anyone have any other questions for me? What's really encouraging, actually, I would like to say this, is that a lot of medical schools have wellness centers now, specifically for the mental health of their students. I will shout out to McGovern Wellness. They are an organization who I have worked with, McGovern Medical School in Houston, and they have a special week for mental health just for healthcare professionals. They are providing resources to their students. I have another friend who goes to UNT in Fort Worth, and they have their own kind of medical student wellness group right now where they're discussing what they're going through on that group together and getting through this together. And I think that's amazing and commendable right now, especially. And if you do know of these wellness groups at your school, at someone else's school, please share that information with us, and we will gladly share that with the community, because it's important to have these safe spaces to speak to one another and to express yourselves about what's going on. And if you know any healthcare professional students who need this help, who need some sort of resources on how to take care of themselves right now, feel free to redirect them to us, and we can try to help them out by providing some resources and teletherapy information. So let me move on to some more content. So one thing that medical students are addressing is the way their mental health will be affected in the future by this happening right now. So what does that mean, right? We're talking about the traumatic impact that this experience will have on healthcare professional students while they go through their career. Some of these students are not getting to finish their rotations and going directly into the field, like we discussed before. And how will this impact them in the long run? You know, their whole perception of being a healthcare professional has begun with a crisis. And this will completely change how they kind of think or approach the profession on a long-term basis. And there's an interview with AAMC that discusses that. I'll quote, I'm worried about my class's mental health. I'm worried about 10 years from now when students of the class of 2020 are tired, burned out, and have PTSD from early days in their careers. This is a very sad problem that might occur, but we will have to figure out how to help them cope with this burnout, because they might experience this earlier in their careers. Many medical professionals do experience burnout, 10 years, 20 years in, or during such a crisis. But seeing that these students might experience it sooner because of COVID it's sad and it's alarming. But we do have these resources to help them cope with their mental health, and it's important to increase the access and awareness to mental health too right now, because we will be needing it in the next few years much more than we have needed it before, because the whole community at once is experiencing this trauma and this stress and this increased heightened sense of fear. Hi, thank you for joining. I have some new people on. If you have any questions about healthcare professional student mental health, please go ahead and drop it in the comments. We have a few minutes left here, and I will be happy to kind of answer your questions. So another thing that the students are going through is that their residencies are starting in June or July. So I think one big concern they have, a fear that they're having, is how will I move to this different state right now? Example, what if someone has a medical education here in Houston, they're living here, but their residency is in New York or California, somewhere that is heavily hit, and that tension of traveling with all of your things from here to another city that's heavily affected. I'm sure there's fear involved in that. There's fear in flying right now, of course, which we should be minimizing in general unless you are a healthcare professional who is going to help others. There's a fear in that. What if my residency doesn't start in June or July? Will this completely kind of hinder my timeline of medical school, of me becoming a professional? Internships are being canceled over the summers. I know that the graduate school that I am attending, they have they have an internship requirement, and if they've gotten canceled this summer, then they have to do them in the fall or in the spring or at a different time, which delays their graduation. So there are a lot of these things to think about in terms of how to cope with them. How do we handle the fact that our life is not going to go how we thought it would, at least in the near future? I think acceptance is the biggest thing we need to learn from this as students. Acceptance that, hey, it's okay. It's not going according to plan. A lot of people's lives are not going according to plan right now, correct? But, we need to learn acceptance and saying, okay, this is what the situation is right now. The best choice is to accept that this is happening and move as needed. Slow down if you need to slow down. There's nothing wrong in slowing down right now. A lot of people are using this time to, learn a new thing or kind of remake their health or work out a lot. People are doing these things, which is fantastic. But on the other end, if you need to take a break, take a break. Take that time to mentally reconnect with yourself about what's happening, to digest what's happening, and to cope with the fact that as a healthcare professional, things may not be going as you would like for them to go. Places reopening quickly, people not wearing masks in public, people gathering in large groups right now in public, despite the fact that you shouldn't be doing that right now. It's hard to deal with as a healthcare student, and that's something, again, you need to kind of accept that you only have control over what you do and what you say. And so, keep going, keep providing this help to the society, know that you're an important part of what is happening, and that is, people appreciate what you're doing. People appreciate all of this help that you're providing. So I'm gonna give a few minutes for some questions now and take a sip of water. So Fatima, can you elaborate a bit about your routines with children? Are you speaking about your own children at home? Because that is something that can be discussed. So someone has commented that they're having a hard time figuring out a routine for their children right now. I myself live with children currently in my family, and I can speak to the fact that it is difficult, and the best way to kind of figure out a routine for children is to include a lot of active time, a lot of play time. Judith, yeah. It's really what I've seen everywhere when I myself look at, how to help people with children, with the schooling online, which is so odd kind of at times, right? It's, your kids are like, what's happening right now? How am I seeing all these people on the screen? Especially if they're, much younger, which is who I have in my family, young kids. It's important to sit with them and talk to them about what's happening. Hey, how are you handling this? Do you miss your friends? Who do you miss? Do you want to set up a FaceTime with your friend from school? Even as a 3-year-old or a 5-year-old or a 7-year-old, it's important to have this connection with your children and with their peers. So there are things like, I personally did not know about these until recently, but Facebook Messenger for Kids, which is a supervised way for your children to kind of chat with their friends. They can have these Zoom calls with their friends where it is supervised by your parents. There are other ways, such as a lot of websites that you wouldn't expect to have activities for kids have so many activities for kids right now. Coloring pages on things that they might not usually see, that are not cartoons but are buildings or just new things for them to learn about. And yeah, it is important to limit the screen time, which is hard right now. It's so hard to limit screen time, but that is a very important thing that we must still keep in mind, because they're young, and looking at this blue light for a long time can be harmful. So that's some tips I have are to create that routine with your child and to make sure that that they have things to keep their time occupied with, which is hard. But we have resources on our website for this, specifically for children's mental health and for school mental health. We have a wonderful Center for School Behavioral Health that can help provide you with those resources. They're doing so many webinars about this. It's amazing. So if you are interested in learning more about school behavioral health and children's behavioral health, I would recommend being in touch with them. Are there any other events this month that discuss mental health for me to join? Yes, Gustavo, there are. So we are having Mental Health Awareness Month right now. That is what this is a part of. And this week on Thursday, there is a panel called Communities of Color, where we will learn about minority mental health. And there is another event today that you can join at 3 p.m. that if you could remind me, Gustavo, what the title of that event is. But there is another event today. There are events every single week discussing various things about mental health right now. And if you're interested in contributing or commenting or being involved, please go ahead and do so. We're open to speaking to the community, as that is the population we are serving. My struggle is that my children are in a health professional high school. They are questioning whether medicine is what they want now. That is so hard, and I can understand that, being children, and knowing that there are other options. That makes a lot of sense. But I think something to help motivate them is that look how much your profession means. Being in a health professional high school, having that future set up to be a health professional is scary right now. That is totally understandable. But it's so important to see that look how much impact you will have. Look how important you are for the world's safety, for everyone's safety. And there are a lot of options. That's another thing I would explain to your children is like, there are so many options within health professional that you can go into, you know, doctor, nurse, public health professional, mental health professional, PA, PT. There's so much you can do. So I would encourage them right now to take the time and research all the different health professions that they could be involved in. What does this health professional have as a role in COVID, you know? If that's what they're looking at as a benchmark, which I totally understand right now. That is what's happening. Thank you for linking the center. If you go on Facebook during our chat, the center's link is in our chat for this live. Thank you, Brenda. Thank you so much. All right, well, I have gone a little bit over, but thank you so much for joining me today. This has been a really great discussion. Join me again next week at 10 a.m. and we'll be discussing more students' mental health. Next week is collegiate students' mental health. So if you know anyone who goes to college, if you know anyone who just graduated college, who was forced to graduate college early, forced to leave their college town, their dorm, their college friends, not sure about the future, not sure about what's happening job-wise in the fall, encourage them to join my live next week, and I will have some resources for them to help them out. Thank you so much for everything. Have a great day, guys. Bye.